Hi guys, my name is Dr. Khare. I am the owner of Innovative Express Care, and I am also an emergency physician. And I wanted to give you guys an update on what's going on at Innovative and a few other things. To talk briefly about our status, we have had 150 positive COVID-19 patients. It's really important to know that we've tested around 850 to 900 patients. So our positive rate is around 15 to 17%, which is about what other hospitals are seeing. It's in the range. We're not testing everyone, as you guys might imagine, but we are testing people who are symptomatic with cough, with fevers, with upper respiratory tract issues. So it's not very strict, our criteria, compared to the hospitals and ER, but it certainly is more than just anybody that walks in. We don't test for those. So 150 positives. Luckily, knock on wood, no one has died. So that's really good. Now, I wouldn't go on and extrapolate that this is not deadly. I want to make sure you understand that. The reason is that where I'm located in the 60614 zip code, as well as the patients that we take care of, are relatively healthy. And I've told that to all my colleagues and friends when they look at our numbers. You have to understand that many people that I take care of at the urgent care as well as primary care don't have significant amount of illness. Some people do, but the thing about COVID-19 that we all are realizing is that it's really not the 15. It's not the 25-year-olds to 45-year-olds with one or two little things that's going on with them. We're really worried about the patients that are over 60 years old, right? Who have lung disease or have heart disease or have history of strokes. Those are the people who we're really, really worried about. So just remember, even though we haven't had any deaths, we have had significant viruses with 150 positive COVID-19 patients. So we're still learning a lot about it, which brings me into how can we decrease the amount of patients that are getting the virus. So how can we decrease the contagiousness or bend the curve, as they're talking about? As many of you know, I'm a big advocate for this grassroots movement, now becoming big, which is masks for all. I want to very clearly kind of tell you why I believe in this and what we can do to decrease the amount of contagiousness that will help you and your family members. So first and foremost, masks for all. The idea of it is basically that when we go out of isolation, when we go to our essential places that we need, which is things like the grocery store or Target or Costco, when we go outside of of our isolation, that when we are interacting with other people that may be less than 6 feet away, that we put a mask on. And it doesn't have to be an N95 mask or even a surgical hospital mask. It could actually be like a face mask that covers your nose and your mouth. It can be a bandana. It could be a cloth. It could be homemade, made out of a t-shirt. So it's really important to know that it doesn't have to be a surgical mask. For example, if you go to the CDC website that says CDC cloth mask, they actually show you how you can make one out of an old t-shirt. It's a really easy process. Even I can do it, and even anyone can do it. So it's something to look at. There's a lot of also information on the internet about it too. So Mass for All is really important, and the reason it's important is because we are asymptomatic, meaning no symptoms, for 5 to 7 days prior to having symptoms. So I have no symptoms right now, but if I had the virus, if I caught it from someone, it would be 5 to 7 days before I would show symptoms that we would be shedding the virus. We are very contagious during these 5 days, 5 to 7 days. So, and when we go out of the house, we put on a mask and we can decrease the amount of particles, the amount of virus that's coming out of our mouths and nose. So it's not going to protect you, it's going to protect the cashier, right? The cashier who's taking your money, your credit card, who basically is caregiving for their 80-year-old grandmother who has emphysema. If she carries that to her grandmother, there is a high mortality rate for her. So this is the idea. If everyone started using this, we would decrease the transmission rate for and that's the whole goal. Listen, we have 2.5 more weeks until 2 to 2.5 more weeks until we have hit our peak, which means this is the time we need to bend the curve the most. The CDC has hinted at this. The president talked about how it's voluntary, which was nice. He said he wasn't going to do it himself, but that doesn't mean that we shouldn't. Right? We have to use science as our guiding, and the CDC is using science. So the fact that they've reversed their claims of that masks should not be used by people outside for everyone. Now they know that in this particular situation, based on the science and the literature that's coming out, as well as how we are contagious before we have our symptoms, I think they've changed their tune. And I really, if we can do that in Chicagoland, in the United States, we could save thousands of lives. It's this the benefit is so large and the risk is so little, that yes, people are talking about how you should remove the mask. That you might fine, remove it carefully, wash it if it's a cloth mask in the washing machine. We don't go out very often. We shouldn't be. So I'm just begging you guys to just think about it. I know it doesn't feel good to have a mask outside. Me and the kids walked to Wrigley the other day and we had masks on, and I know we were looked at like we were crazy. But sincerely, when I went to Shake Shack to pick up our meal to come back home, like I'm helping them, and I think it's important that we do our part. And in the next month, that's it. This is not forever. Lastly, I want to talk about how you can make an appointment here if you or your loved one feels that you may have symptoms of COVID-19. It's pretty simple. Just go to our website, innovativeexpresscare.com, and hit on the COVID link, and then click on a telemedicine to make a telemedicine appointment. The telemedicine appointment is for everyone except for first responders and healthcare workers. Those guys can make an appointment and get in. Those guys are at very high risk of getting COVID-19. Healthcare workers are 30 to 40% higher risk of getting COVID-19 than the rest of the population. Hence, I don't make them go through the screening process. The screening process is important because I don't want anyone just to get screened. There are exceptions to every rule, but if you don't have any symptoms and you're not caretaking of an older person or someone at risk, even though we'd like to know if we're a carrier, if we have it or not, the truth is it's not a valuable test. Those who have fevers, those who have upper viral um, um, uh, upper respiratory symptoms, any viral symptoms such as cough, shortness of breath, those patients, we have to make sure you have that, and then we want you to get tested. So that's why right now we are still requiring the telemedicine screening process. That may go away in the next few days as we have more ability to test and could test everyone. But for right now, please do the screening unless you're a first responder or a healthcare worker. That would be helpful. When we do the test, we run it through our normal insurances. So we take most PPOs, we take Medicare, and we will run everything through that. So just know that we are here for you, and we've had 150 cases, and that you should wear masks when you leave the house and are in public. So that's about it. Please email, call us, or book a telemedicine appointment if you feel like you want to get tested. We'll be happy to help you out. It was good to see you guys again. Please share this video and be safe out there. Listen, this is the most important time to really be strictly isolating yourself. And the reason is that we're about to hit our peak. And anything you can do to not get this would be helpful to you and your family members. A lot of you without chronic conditions might be thinking it's not a big deal, but just think of the older patient population, the older family member of yours that if they got it, they would be sick and on a ventilator. And we need to reduce the amount of hospitalizations by not spreading it. So that's the only thing we can do as a society. We're going to let the ER doctors, the ICU doctors, all the nurses and the MAs in the hospitals, we're gearing up for an onslaught of patients, unfortunately. And but these next 2 weeks, the most important thing we can do is stay inside, wear masks when we're outside, and wash your hands every hour while you're out and about. It's really important. So good luck to you guys. Stay safe, and let us know if you need anything.